Hello, my name is Francis Park with Indian Health Service, and I'm here today to provide some information regarding the Navajo Safe Water Access Mission. For those of you who may not be familiar, the Navajo Nation, in collaboration with the Indian Health Service, has been increasing access to safe drinking water for residents of homes without piped water. This consists of providing free water, water storage containers, and when needed, chlorine disinfection tablets to keep water safe for human consumption in the home. This training is intended to provide you with key information regarding the chlorine disinfection tablets you will be receiving. It will also go over how to administer the tablets and answers to commonly asked questions regarding chlorinated water that you may receive from community members. When it comes to chlorine disinfection tablets for drinking water, chlorine has been proven to reduce bacteria and viruses in water that can normally make individuals sick. In some cases, stored water can become contaminated when someone's hands, dirt, or other objects enter the water container. Household water treatment and safe storage of drinking water can lead to dramatic improvements in drinking water quality and reduction in illnesses caused by harmful pathogens or other waterborne diseases. By using the chlorine tablets each time a water container is filled, we are able to inactivate these harmful pathogens to keep each community member's water supply safe and families healthy. The water at your water point is already disinfected through the addition of chlorine and is regulated by the Navajo Nation Environmental Protection Agency. This is to ensure that it is safe and no harmful effects are likely to occur. Small amounts of chlorine is safe to drink, and in fact, most drinking water systems in the United States add chlorine to their water. Although chlorinated water can taste and smell different from untreated water, chlorine levels in your chapter system have been determined to be safe by field testing and are maintained at acceptable levels. We are asking chapters that will be receiving disinfectant tablets to place a tablet into each resident's container. The tablets should only be added to the blue 5-gallon storage containers that were provided because it allows us to ensure the amount of chlorine that is added is safe for the amount of water in the container. In addition, chlorine tablets should not be provided to residents to take home, as this can result in overdosing of water supplies if used improperly. Once the tablet has been placed in the container, mix the contents and allow it to sit for 30 minutes. After 30 minutes have passed, the water is safe to drink. If your chapter is not distributing water disinfection tablets, it is because the disinfection levels at your chapter's water point have been determined to be sufficient to provide the needed protection in your stored water. Now, there will most likely be a chlorine taste to the water soon after adding the tablet. However, again, the water has been determined to be safe by field testing, and a slight chlorine taste is completely normal. If residents are bothered by the taste and smell, advise them to put a pitcher of water in a safe place, such as the refrigerator, and let it sit uncovered for a few hours. This will allow the chlorine to leave the water and should improve the taste. An extremely strong chlorine taste is an indicator that the water may be overchlorinated, and these cases should be reported to a chapter official. Now that we are familiar with adding the chlorine tablets, I wanted to go over some frequently asked questions that may come from community residents towards your chapter staff. These are commonly asked questions regarding the chlorination of water and may help you respond to any requests for information from the community. In addition, this information should be available on the NavajoSafeWater.org website, and we are also available to answer any questions you may have. So if we look here, if we look at the back side of our disinfection tablet, it'll have some commonly asked questions and answers. So the first question that we have here is, what are the health benefits of adding chlorine disinfection tablets to water? If a resident were to ask this, we would respond that when added to drinking water, chlorine has been proven to reduce bacteria and viruses that could make you sick. Stored water can become contaminated with bacteria or viruses when someone's hands, an object, or dirt enters the container. The use of chlorine tablets inactivates these pathogens to keep your family healthy and prevent disease from spreading. Another common question may be, if the water is safe to drink, why do I need to use a disinfection tablet? In these instances, it's useful to explain that the tablets are used to extend the time that chlorine remains within the water. The chlorine residual in the water drawn from the tap is not sufficient to protect the water from contamination while being stored in the home. The disinfection tablet prevents against contamination by ensuring chlorine is detectable within the water over a 7-day period. If I have a different container than the blue 5-gallon containers provided, how many chlorine tablets should I add? For these situations, the chapters will be distributing the disinfectant tablets and should not add the tablets to any containers aside from the blue 5-gallon containers provided. This is because there is a risk of not adding the correct amount of chlorine and because of what other containers may have been previously used for. Use of multiple chlorine tablets or different containers is not allowed because it can potentially expose residents to too many chemicals or any other unsafe items that were in the containers. The next question says, the disinfection tablet makes my water smell and taste strange. How will this affect my health? So in these instances, it's the answer that we are able to provide would be there will most likely be a chlorine taste to the water soon after adding the tablet. The water has been determined to be safe by field testing, and a slight chlorine taste is completely normal. If they are bothered by the taste and smell, they are able to put a pitcher of water in a safe place, like the refrigerator, and let it sit uncovered for a few hours, like we mentioned earlier. This will allow the chlorine to leave the water. However, in certain instances where there is an extremely strong chlorine taste, this may be an indication that the water is overchlorinated and should be reported to the chapter. The last question that we have here is, can I use the blue 5-gallon container for other purposes? For these instances, the blue 5-gallon containers should only be used by individuals as their source for drinking water, cooking, and hand washing. Using the containers for other purposes can contaminate the container, compromising the safety of the home's drinking water supply. In addition, the container should not be used to store anything else except safe drinking water. And this will help ensure that our containers do not become contaminated and our water source remains safe. So this is the brief training over the providing the disinfection tablets to the community. If you have additional questions, you may refer to the website or call the phone number listed here on the flyer. And thank you very much.